Hello, today we'll be presenting our research on the impact of social determinants of health on cardiovascular risk profiles in Asian American subgroups. One person dies every 36 seconds of heart disease, with South Asians having 4 times more hospitalizations due to coronary artery disease than any other ethnic population in California. Past studies have found that poor English proficiency, low education, and low income are all predictive of heart disease. However, other factors such as acculturation, healthcare access, and food security have not been studied as factors affecting cardiovascular health among Asians. Thus, our research question, how do social determinants of health affect cardiovascular health risk factors among Asian subgroups compared to non-Hispanic whites across the United States? We conducted an observational cross-sectional study looking at the National Health Interview Survey for years 2006 to 2018. Our total sample size was 260,262, and we conducted a multivariate logistic regression. We compared non-Hispanic whites to Asian Indians, Chinese, Filipino, and other Asians, and their cardiovascular risk profile scores.
Let's turn to the forest plot on the very right of our poster. Everything to the right of the dotted line, or an odds ratio of 1, indicates an optimal cardiovascular profile, and the variable is a protective factor. Everything to the left of that line indicates a suboptimal cardiovascular profile, and the variable is a risk factor. For the purposes of our presentation, we're only going to be mentioning 2. Starting with the risk, for those who delayed medical care due to no transportation, these individuals may not have addressed early signs of cardiovascular risk. Hence, their cardiovascular risk became more serious and they have less optimal cardiovascular health. Moving on to protective factors, for those who did not see a doctor within the past year, since they didn't seek medical attention, they could be undiagnosed and unaware of certain cardiovascular risks. So they indicate that they have a optimal cardiovascular health when they actually don't. All other risk and protective factors are listed on the lower left in our discussion section.
Well, in terms of limitation, and his dataset were collected in the form of the self-reported survey, increasing potentials for vehicle and social desirability biases. In addition, the survey conducted only in English and Spanish, making Asian with lower English proficiency less likely to respond. As such, the findings of our study may not necessarily be generalizable. Our next step is to do age standardization for our forest plot and further look into differences in risk between Asian subgroups. Thank you so much.